This is Fox News First.
Welcome back. The statistics are staggering. In the U.S., about 30 million children and teens participate in some form of organized sports, and it results in more than 3.5 million injuries each year. And Dr. Casey Tabor from the San Antonio Orthopaedic Group and practicing orthopedic surgeon at Baptist Health System is here this morning to make sure that we can tell parents out there and young people what they can do to avoid sports injuries, right?
Yes, ma'am.
All right, let's talk about it. What are some of the most common sports injuries that you find in children?
Well, by far in kids, they're pretty resilient. So most of the stuff we see is just temporary sprains, strains, contusions, which are most of the time they're down for a short period of time, but they'll come back pretty quickly from those. It's some of the bigger injuries that we worry about, but by far the most common injuries are lower extremity sprains and strains.
Are there any ways you can actually prevent the injuries from happening in young children and teens?
For me, I kind of look at three different aspects. Number one is obviously correct gear.
Okay.
A lot of times the parents will hear, well, it's just practice, I don't want to, and actually most of the injuries occur at practice, not during the game. And so simple things like playing soccer using your shin guards. If they're playing something with balls, they may have glasses or protective eye gear. Braces, these are some of the smaller braces, but they also have very more robust braces for sports like football, lacrosse, and with the eye protection with the helmet. So all of those things play a big role in it. The other thing is stretching. You know, you hear that all the time, but that is an important aspect of prevention.
And this is such an easy piece to pick up at any sports store, and it's great to roll your muscles out and things like that. It doesn't cost very much at all, and you can do it anywhere.
No, and it looks really big and bulky, but it's actually made of foam, so it's very light, and that's one of the ways to kind of roll the muscles out. And then obviously all the traditional stretching exercises that we do. And then I think, and this has become more recently, but the third thing that I look at is kind of rest. You know, we get so focused on your kid being an excellent athlete, and then they get into these elite sports and they play year-round. It's important to allow the kid time off for mental relaxation, but also on the physical side of things, because I think when they're participating in sport after sport, or it's the same sport all year round, they don't get their body time to rest.
Well, I want to also talk about some of the sports that are maybe less impactful on the body that you would recommend kids start out with, especially the teenier ones.
Well, obviously, probably one of the ones that younger kids start out with is soccer, and that's a pretty low impact sport, especially at that age. As they get higher up, that can be a little bit more challenging. But obviously, they can play golf, tennis, soccer, hiking. Swimming is another good one, especially in the hot weather. So we have lots of swimming here up north. That's not really possible, but down here we have swimming almost year round.
Yeah, so that's a really good thing.
Impactful sports.
And if your child does have a sports injury, what should you do? What should parents do at that very moment?
I think initially, the day of surgery or immediately, get it iced, get on some anti-inflammatories, let the kid rest, come out of the game or practice. If there's a lot of swelling or a lot of bruising, that usually indicates a more serious injury. You should go see your physician if that's a problem. If it's anything, if they're knocked unconscious, there's been a lot of media on concussions. I think you should probably go to the emergency room on an injury like that.
Okay, all great tips. This is Dr. Casey Tabor from the San Antonio Orthopaedic Group. He's also a practicing orthopedic surgeon at Baptist Health System. If you need more information, you go to bhsjoints.com or call 297-7005. We'll have those links on our website at foxsanantonio.com. We appreciate you being here.
Thank you.
I know you've got a busy day ahead.
Thank you.